Welcome back to day 2 at Eyes on Dry Eye 2023. I'm your co-moderator here in the exhibit hall, Dr. Damon Durker, coming to you live from Indianapolis, Indiana. Our next session is entitled Umay at-Home Compliance with Parasympathetic Activation and Intentional Rest. I'm joined by Dr. Mila Ioussifova and Dr. Michael Gradisar. Welcome to Eyes on Dry Eye. Are you guys enjoying the show so far?
It's been great, as always.
Appreciate that.
Absolutely.
So Dr. Ioussifova, briefly, can you tell us a little bit about your practice? I know you're an optometrist. What are you doing on a day-to-day basis?
Yes. Well, first of all, thank you so much for inviting me for this opportunity. This is exciting to talk about this technology. I am Mila Ioussifova. I'm an optometrist in Portland, Oregon. I have a private practice, which is mostly dedicated to dry eye disease. So we do a lot of the advanced in-office procedures. I am also a nutrition specialist in training. So I really like to incorporate holistic approach to when I'm treating my dry eye patients.
And Michael?
Yes, so I'm a clinical psychologist in training. Or not in training, but that is my training. So I've been basically practicing and specializing in sleep disorders like insomnia, circadian rhythm disorders, and also been doing research for the past, say, 20 years when it comes to sleep. And I've been just fascinated, I guess, when it comes to sleep and the sort of advances that have been happening with technology, because when it comes to technology and sleep, it's been around, for many decades. That's how we try to measure it. But certainly it's really been contained in labs. And so now the fact that we're sort of getting technology and a lot more technology into people's houses, it's been a fascinating boom we've seen in the last several years. And I think that's what attracted me to Umay and their particular device as well. I could see really that they were sort of in a niche market where everyone was sort of focused primarily in the evening. This was really something that could sort of help people throughout the day. So I'm really excited to be here and chat today.
And Mila, I understand that you've been using this technology in your practice for your patients. Can you tell us a little bit about that?
Yeah, so first of all, I'm a user as well. I love this device. And for patients, really, where it's really been effective we do a lot of advanced in-office treatments, but what's been lacking is that compliance for patients to do home treatments that would really help with what we're doing in office, right? So we could be doing a lot of the fancy treatments, but essentially if the compliance is not there to continue, then the efficacy or the treatment, how long they last, may be limited. So that's how it came. I've been excited, and it's not, and we'll get into the science of it a little bit later. It's really not just a heating device. That's the thing that we want to really emphasize, that it actually activates parasympathetic nervous system, which again, we'll get into, and that's where the exciting part for me has been.
Yeah, certainly the theme of the weekend, or a couple of themes, have been, how do we get our patients to be more compliant? And neurostimulation has been a big theme all weekend. But let's get back to the blink, because I know, Dr. Gradisar, that's been something that you've had a lot of experience and research in. We think about it in the dry eye space as decreased blink rates with digital device use, but really the blink is actually quite a bit more complex than that. It's not just about our ocular surface. There's a lot more going on neurologically. Can you kind of expand on that a little bit?
Yeah, certainly. And blinking is actually quite fascinating, especially when it comes, I guess, to alertness and sleepiness. Like, say, for example, if you look at some of the research and you look at when people are sleep deprived, you can really sort of notice that there is a change in that blink rate. In fact, if anything, it's really the sort of duration of that blink that can be quite significant. And that really relates to, in some ways, alertness and how much attention that you're paying. So people would understand that, a lot of people, when they're sort of engaged in some sort of task, and especially we've seen that when it comes to working on computers and so forth, that blink rates will decrease. But when they do actually have a blink, that's almost like a pause in their attention. And so, I mean, I've been fascinated, certainly from a sleep and alertness type of angle there, and looking at sort of different parameters, ways that people can actually measure that sort of attention, that concentration, and hence that leads to performance. And hence why I think really when it comes to blinks, if you asked a whole bunch of different people on the street, I guess a lot of them would sort of say, yeah, it's there really to sort of moisten the eyes. But certainly there's some sort of attentional brain sort of relaxation or pause in the background that's happening as well, that allows us to sort of have that moment to sort of breathe, you know, like our brain is sort of breathing, and then we can continue on with that. So when we're not blinking as much, what I'm fascinated about is how that would then ultimately affect performance and sustain performance, really, because we really need to be able to have that sort of pause with our brain and being able to sort of then go for the next stretch of concentration, really. So yeah, fascinating stuff.
I think about, I've been on camera all weekend and blinking a lot, or maybe not blinking a lot, and there's probably a lot you can tell by looking back at the tapes as to what's going on in relation to what my blinking looks like. But let's get back to ocular surface disease for next topic here, and really a shift in the last few years on our attention with dry eye really being a lifestyle disease. So Dr. Ioussifova, what's the connection between dry eye and mental health?
So we've known about the impact of screen time on our blink quality, ocular surface, and dry eye. We know that screen use is one of the contributing factors to dry eye, which is now the #1 reason why patients actually see their doctors. It used to be the second one, but now it's rising. But screen time is also it also impacts our mental health and our sleep habits. And we have already known about the evidence that there's a link between mental health, like anxiety, depression, and dry eye. In fact, in 2022, there's a study that showed that patients with dry eye disease, 30%, up to 30% of them also had anxiety and depression. So what's happening with these patients with these conditions, with depression and anxiety, is that there's an overactivation of the sympathetic nervous system, which is our fight and our flight. And there's also increased cortisol levels, inflammatory markers, which can actually influence the way that we process pain. Which is why when we're dealing or we're managing patients with neuropathic pain, these are our very difficult patient, dry eye patients, right? We maybe, with our traditional in-office treatments or pharmaceuticals may not be helping these patients because those other things, like anxiety and depression, that parasympathetic nervous system is not addressed. So we may be missing the target if we're not addressing mental health and sleep habits when treating our patients with dry eye disease.
Yeah, clearly dry eye is more than just about dry eye. There's a lot else going on, and we have to be taking care of our patients and understanding all of the things that are happening, maybe leading to dry eye and happening as a result of dry eye. When we look at how we are focusing our treatments for dry eye and meibomian gland dysfunction, the mechanisms for a lot of our treatments are thermal or based on heat. Dr. Gradisar, can you kind of work through review some of your work in thermal regulation and how it impacts patient sleep quality and routines?
Yeah, sure. So I guess back in the early 2000s, that's when I was looking at thermoregulation, sleep, and insomnia and circadian rhythms. That was part of my PhD research. So what I was fascinated in was sort of like those minute-by-minute changes that were happening when it came to thermoregulation when we're trying to fall asleep. And so initially what I was discovering was that as we attempt sleep and fall asleep, that we'll have these really dynamic changes that are really occurring across the different skin surfaces. And in order to fall asleep, we really need to sort of decrease our internal core body temperature. And the way that's done is that we need to release that heat, and we release it through the skin and certain skin areas. So I was really focused, I guess, on the hands and seeing the sort of heat escaping from the hands. But there were other researchers at the time that were also looking at other parts of the body. So it was really our sort of hands and our feet is where we're losing that heat, but sometimes also around certain areas of the face, say, for example, nose, lips, and ears. And I guess I became fascinated into why this is happening. And after a series of experiments, it really boiled down to the fact that there was something going on with the eyes. It was a simple sort of shutting of the eyelids that you would see this really rapid increase in skin temperature from the hands and helping to cool the body to help facilitate sleep. And even after that, I started to get even more fascinated. You know, was it the fact that we're sort of shutting our eyes, or is it turning the lights off? Is it the cognitive intention to sort of rest and fall asleep? And certainly when it came to that sort of change from light to dark, that was actually signaling to our body it's time for rest and it's time to actually fall asleep. And we would see these changes in thermoregulation. But when people were actually having the lights turn off or just shutting their eyelids, it's really like the eyelids are the blanket over the eyes. They're really sort of helping people to start to fall asleep. And we saw the major changes when that was occurring, which again is a sort of a fascinating concept, because in some ways it's evolutionary, but in some ways maybe there's also a psychological component there. We've sort of had practice at doing this time and time again. And certainly when you look at people that have thermoregulation problems, they seem to also have sleep problems as well, like say, for example, diabetes. So thermoregulation is absolutely necessary when it comes to falling asleep. And I guess what I found quite interesting when I heard about Umay was that they had basically stumbled upon something that was actually helpful for sleep. And there's an absolutely obscure study that was looking at the correlation between hand temperature and our corneal temperature at the surface. And there's a significant, not just a significant correlation, but it's around sort of 0.6, 0.7, which is actually quite large. And so it's very clear that there's a connection between what's happening with our eyes and the thermoregulation aspect, and then falling asleep.
Yeah, that's really interesting. That's all new information to me for sure. Dr. Ioussifova, another topic this weekend has been this parasympathetic activation, and we need to think about neurosensory abnormalities in patients that have symptoms of ocular surface disease that are maybe more severe than what we see clinically, and we see that not uncommonly in practice. So why is parasympathetic activation important in dry eye management? And what are some of the ways that we can actually increase parasympathetic activation?
Well, the lacrimal gland is mostly innervated by the parasympathetic nervous system. And I love that we have those devices. We have pharmaceutical and some external neurostimulator that addresses that, but that's done at the local level. So for patients that have neuropathic pain where central nervous system may be involved, those may not be enough. And what our modern life, the stressors in modern life really leave us more in a sympathetic tone, which down regulates the parasympathetic nervous system. And that system overall is parasympathetic is for rest and digest, but it's also for secrete. That's when our glands secrete. So our secretory glands, lacrimal glands, secretes when the parasympathetic nervous system is activated. So some of the ways that you can activate this nervous system, parasympathetic nervous system, is doing yoga, meditation, and mindfulness practices. Deep belly breaths is a very important one. But also the biggest one is sleep. When we sleep, that's when our parasympathetic nervous system is on. And so that's where the importance of sleep comes in. That's why we have to have these discussions with our patients, asking them about their sleep habits when we're taking their case history. Because if they are only sleeping a couple of hours a day, their parasympathetic nervous system is dysfunctioning. And when that happens, their lacrimal glands are dysfunctioning. So this is where that the whole correlation comes in. So in something like a device like this, not only helps us to kind of open up that conversation with patients where we can talk about the importance of incorporating certain practices to really help them relax, unwind, take breaks from their screen throughout the day, and really have that good habit at night as well.
So I think my takeaway there is we really have to be more intentional about activating that parasympathetic pathway if we really want to provide our patients with the best solutions for their dry eyes. It's a complex process. With that in mind, we look at all of the things that are activating that sympathetic system in our digital lives. And we've got an upcoming TFOS lifestyle workshop, that publication I'm looking forward to. Dr. Ioussifova, what do you see possibly evolving in our at-home management as a result of that publication?
Well, I'm very excited to see that, to see the results of that, because again, this is something that I've been incorporating in my practice, that whole holistic approach along the side of with the advanced treatments we do. So I'm hoping that this will shift our way in treating patients with dry eye disease, to really incorporate in-office at-home treatments so that they can actually benefit more from the treatments that they're doing in office. So this is something that I think is going to shift the way that we prescribe these mental breaks, and taking they're overactivating or activating their parasympathetic nervous system, and taking sleep very seriously, and really prescribing sleep to our patients.
That's great. Let's get back to the pandemic and COVID. And Dr. Gradisar, we've seen this, dramatic transition in how our patients are working and living their lives, how they wake up, how they wind down. We see the impact, typically negative impact, on the patient's eye health as a result of increased screen time. But when it comes to rest and recovery, how do you see the role of thermal regulation and routine becoming part of the conversation when eye care providers are recommending at-home treatments?
Yeah, I think a key thing here, and we've touched upon it, is when you're, I mean, if we sort of step back and we look generally at, here's a condition and here's an evidence-based treatment, it's not as simple as that. It's great that you can have an evidence-based treatment that will be very effective for something like that. But at the same time, it's a case of compliance. You're not there to actually deliver it. The client has to go home and do their homework in some ways. And so, and that's been an area of fascination, I think, especially in the area of sleep. When you look back at probably the first technological device that people were using to improve their sleep, which was a CPAP device, that sort of whole vacuum on blow that they had to put on their face overnight, which is a highly aversive thing to do. And as much as it's got great evidence, it's like you don't see the compliance there. So we've known about this for quite some time. And I guess what I found interesting is that when it comes to trying to sort of break that pattern of being in front of your computer or having that sort of task that you've got to really sort of sustain across your day, having a pause is really important. So we've done some research, say, for example, when it comes to power naps. The power nap has been shown to sort of take just slightly over 10 minutes out of your day, which hopefully you would imagine people could do to sort of provide some fantastic results and really sort of increase your task performance for 3 hours after that. And I guess what I found quite interesting when it came to the REST device, and when I tried it for the first time, I was like, holy crap, this is almost like a power nap. And it's more of a power nap because it only takes a few minutes and you don't actually have to be reliant upon falling asleep. So there's certainly something about that relaxation component that you can sort of get, especially at the end of the day when you can sort of shut your eyes and so forth. And certainly there's also that ability to be able to use it for a power nap in the afternoon if you want. But because of this thermoregulation aspect to it, it's got the warmth and it's also got the coolness. What can also happen is that if you are warming the eyes, yes, you'll relax, but if you're cooling the eyes, you're starting to wake up. So this also could be a device that you could use first thing in the morning, have it by your bedside, help to really facilitate that alertness when you need to. And so I think the difference with this sort of particular treatment is that, I've seen some initial data and it certainly has improved sleep quality, which I find quite fascinating. But in regards to having a treatment, like if you look at something like CPAP that is quite aversive versus something like the REST device actually is a bit of a reward. So you can imagine that people will get into that habit. They'll sort of get reinforced to actually use a device like this. And therefore, I would imagine you would start to see better compliance with that. And if you got better compliance, then you're becoming much more of an effective clinician. So it's going to be fascinating to sort of see this as it rolls out and becomes implemented.
So we've touched on quite a bit here in this session, looking at thermal regulation, parasympathetic activation, the role of sleep in dry eye disease, as well as mental health. Dr. Ioussifova, if you kind of wrap up all these things, how is this changed the patient conversation now with the Umay technology?
Yeah, well, here's what the technology looks like, and the convenience has been the biggest thing, is that with one button, not only you can activate the heat, so for MG, which we're very familiar with that, so MGD component, treating MGD component, but the cooling, as Michael mentioned, using it in the morning has been the really fascinating addition, which we've never, as when we're treating our dry patients, we haven't added that component. So for patients that wake up with irritated and inflamed eyes, this has been a great addition. So this opens up the window for me to talk about the new technology with my patients, but also that holistic approach to really incorporating everything else that's important in that parasympathetic nervous system. So it's kind of like a perfect, blend of treating dry eye, but also that mental health and sleep component.
Really fascinating stuff here. I learned a lot in this session. Thank you both. And thank you for joining us at Eyes on Dry Eye.
Thank you.
Thank you.